So I'm at the patient's bedside. I've checked the area is safe. I've made sure the windows and doors are all closed for privacy. I've asked the patient their preferred name and I've introduced myself. I have then asked them to confirm their name and date of birth, and I've also checked that they have no allergies. The patient is comfortable, not in any pain, and I'm now going to explain the procedure to the patient. Hi Sophie, I just need to take a specimen of urine from your catheter. It means just looking at the catheter tubing, we're not going to expose any area of your body. We just need to take a sample to make sure that you haven't got any infection present or any proteins or anything like that. Are you happy for me to proceed with that?
Yep, that's fine.
Okay, I'm just going to get the equipment ready and I'll be back in a moment. So I'm going to sanitize my hands. I'm going to check the expiry date on the gel, which is fine. I'm going to use the 7 steps of hand hygiene recommended by the World Health Organization. I'm then going to pop on my apron and gloves. I'm going to open my clinical waste bag and pop that on the trolley. Okay, so we've got our clinical waste bag there. We're going to assume that the tray has been washed with soap and water in the past 24 hours. I'm going to use an alcohol wipe in a zigzag fashion to clean the tray. And then dispose of the wipe into the clinical waste bag. We are then going to check the expiry date on the alcohol wipe, which is fine. We need a 10ml syringe, and again we need to check the expiry date, and that's fine. A small clamp, expiry date is fine on that one too. We also need a needle, 21 gauge you would normally use, and the expiry date is fine on that one. And then we need a specimen pot to put the urine into. So I'm now going to go back to my patient. Hi Sophie, I've gotten all my equipment ready. Are you still happy for us to go ahead and take that specimen of urine?
Yes, that's fine.
So I do need to just lift the sheet up, but again, I won't be uncovering any part of your body, exposing anything. So I'm just going to lift that forward just so we can see. So I do need to apply a non-traumatic clamp to the tubing. There isn't any urine in the tube. If there was, we might not need to apply a clamp. So then I'm going to open the clamp. Pop that on. You won't feel anything. I'm just going to pop this on the catheter tubing. And I'm going to remove my gloves. I'm going to sanitize my hands using the same 7-step approach. I'll put some fresh gloves on. And then I'm going to open that alcohol wipe So I'm just going to clean the tubing and the little port where I need to take the specimen from. So I'm going to do this for 30 seconds. Around the top and then away from the tubing. So we would then let that dry for 30 seconds. Then I've got my specimen pot ready. I'm going to unsheath the needle. Then the needle goes into the catheter port there. And withdraw the specimen of urine. Then remove that from the port, cover your needle. You can dispose of the needle into the sharps bin and then pop that into there. So I would then open another alcohol wipe after checking the expiry date on that, and I would use it to clean the area around the port and over the port, and again away from the catheter. And you would do that for 30 seconds. And then you would remove the clamp from the catheter and make the patient comfortable. I would then remove my PPE. Pop that in the clinical waste bag. And then I would gel my hands using the 7-step World Health Organization approach. I would then apply some more gloves. I would label the specimen pot with the patient's details. I would then place it in a microbiology bag that would be sent to the laboratory. So I would then make sure my patient's comfortable. I would make sure they had access to the call bell there. And if I had touched anything else, such as the curtains or the bedding, I would alcohol gel my hands again using the same 7-step approach.